Of doing things right.
I try my best.
You've been wearing your mask all the way through because you haven't had to.
Do you know, I did wear it all the time in public transport or like in enclosed spaces, especially here at work as well.
With their masks again. So it's a bit strange, isn't it, Dr. Punam? Because you up in Glasgow, it's been the same all the way through.
Yeah, I know no differently. We've been wearing our masks throughout, so I'm really pleased that we're now all going to be taking the same approach. It's important, you know, if I'm wearing my mask, I'm doing it to protect others around me. I want others to do the same. It's a win-win situation, and it's important to remember that masks are very effective, not just against COVID, but against all the other viral illnesses that are circulating at this time of year too. So wear your masks to appointments. Now, it's important to remind people that all of us that work in the NHS, we heard the announcement at the same time as the rest of the public. So we are going to need a few days just to figure out logistics and figure out what's what. But the official advice is that you wait to be invited, especially if you're in Wales. But otherwise, you can log in onto the NHS portal and try book your appointment, as well as calling 119. So I think that if one thing that we can know from the NHS is that we are extremely good at doing mass vaccination rollouts. We do it with the flu every year. We've done it with the vaccine so far. We'll do it with the booster. So do not panic.
So we need to be patient. We will get there. Just
give us a few days.
Okay.
But we are going to be talking today about UTIs and how they affect our behaviour.
Yes.
Which is interesting.
So when it comes to urinary tract infections, most people are familiar with the physical symptoms that we hear a lot of. So things like pain on passing urine, urgency, having to go more often, maybe even cloudy, smelly urine with some blood. People can get fever and chills and lower back pain. These are more the physical symptoms that we see typically in younger people or kind of middle-aged folk, but as we get older, our immune systems change and the way we react to urinary tract infections changes. So particularly in the elderly or people with dementia, you might see behavioural changes. So things like they can become unsteady on their feet, more falls, can become quite confused and even have hallucinations. So I would always say, especially in an older adult, if there's a sudden change in behaviour, always get a urine sample, call your GP and rule out a urine infection.
So is that a myth then, that it's just women and older people that can get it?
So urine infections can affect anyone, right from babies right through to the elderly, but it is way more common in women compared to men. There's two reasons for that. So the urethra, which is a tube, it connects from the bladder, and that's where your urine comes out of the body. In women, the urethra is a lot shorter compared to men, and therefore it means that bacteria can get in much easier into the bladder and the kidneys. The second thing is that the opening of the urethra in women sits very close to the vagina and to the back passage, which means that any bugs or bacteria from these areas can quite easily track in and cause an infection. The other thing is, especially with women reaching the menopause, over that period, your estrogen levels can drop, which can make the vaginal tissue quite dry and thin, again, making it very easy to have infections. So it is a bit of a risk factor in that age group.